Hello to everybody. My name is Francisco Sánchez León. I'm an ophthalmologist. I've been around for the last 30 years in private practice. I have two practices here in Mexico City and another second practice in Acapulco Shore, where I spend all Fridays doing a lot of cataract procedures. During the last 30 years, I have performed over 70,000 cases, and one of the most important procedures that we have in our practice is cataract surgery, and specifically in Acapulco, where we implant a lot of ZEISS CT LUCIA intraocular lenses. One of my main areas of interest definitely is optics of any intraocular lens. So as ophthalmologists, we need to provide the best optics available for our patients. I think we're responsible for the long-term results of what we offer to our patients in their eyes. Well, definitely there is no perfect eye. No? We can have large kappa or alpha angle, or we can have a decenter pupil. So sometimes it's quite difficult to get an excellent result with a spherical IOL. So this lens, specifically the ZEISS CT LUCIA 621 spheric model, I think it comes with a very unique design. This lens, it comes with the spherical aberration, negative spherical aberration in the center that shifts to a positive spherical aberration in the periphery. So it will create a neutral ambience for this lens, which will forgive problems with centration or misalignment of the lens. Well, most of the spheric IOLs, they don't compensate this transition to the periphery. So if the lens is not well centered or tilts, it can create a terrible coma aberration, which will impact negatively in the visual acuity of our patients. So I think it's a very wise idea what ZEISS came out with the design of central aberration and progressively a shift to a positive spherical aberration in order to try to forgive any decentration or tilt that will be terrible in terms of optics for a patient who receive a standard spherical IOL. Definitely, I guess we already know that ZEISS is one of the kings in optics in the world. So everything that it's been developed lately in terms of aberrations, in terms of quality of transmission of the light, but any material, definitely I think ZEISS has taken advantage and has put inside of this ZEISS CT LUCIA IOL. Secondly, definitely the refractive index, which is similar to the PMMA, which is very good. And finally, the Abbe number is 51, which it will provide a better chromatic aberration. And when we talk about chromatic aberration, it means that the patient will achieve best contrast, best quality of image in color. So that's, I think, is a very important issue when we think in the lens to provide the best quality of color for our patients. In comparison to our Acapulco clinic, where we have 30 to 40 cases each day, every Friday. So our patients arrive mostly with 2,200, 2,400 count fingers. And we do a lot of very hard cataract cases. And this is our preferred IOL. So most of our patients achieve excellent results. And I will say I'm very involved in benchmarking in terms of visual acuity and refractive results after cataract surgery. I would say even in those very difficult cataracts, our benchmarking, I would say in terms of visual acuity or best corrected visual acuity, maybe 85% or more of our patients achieve at least 20, 25 or better using this technology in very hard cataracts. So I will say that at least Again, 85 to 90% of our patients will be in between +1 or -1 of spherical refraction after the procedure, even in very hard cataracts.